Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friend. Welcome to this week's episode of the Healing Pain Podcast. This week, we're discussing current topics and beliefs associated with racial bias in pain management and physical therapy. It has been reported that medical students and residents hold false beliefs about the biological differences between blacks and whites and demonstrates that these beliefs predict racial bias in pain perception and the management of effective pain care. My guest today is physical therapist Micheal Holder. Micheal graduated with a Bachelor of Science in Exercise Physiology and a minor in Strength and Conditioning from the University of Delaware, and then went on to earn his Doctorate of Physical Therapy from Misericordia University in 2013. He currently works in outpatient sports and orthopedics and holds certifications in vestibular rehabilitation, functional nutrition for chronic pain, and instrument-assisted soft tissue mobilization. On today's episode, we discuss how pain is treated differently in the African American community, who is more likely to receive pain medication, blacks or whites, pain myths and false beliefs still alive today that hurt pain and sustain pain in African American and other people of color, challenges to accessing physical therapy and other vital health services necessary for the adequate care of pain in minorities and African Americans, and finally, current issues related to minorities and people of color in the profession of physical therapy. Okay, let's get ready and let's meet Micheal Holder and discuss pain and racial bias. Hey there, Micheal. Welcome to the Healing Pain Podcast.
Hi, Joe. How are you? Thanks for having me.
I'm doing well. You know, a couple of weeks ago, actually it's probably been months ago now, I was just walking down the street in New York City and we bumped into each other on West 22nd Street. Everyone thinks that New York City is such a big place, but the truth is New York City is tiny. And we just started talking and you've been in one of the courses that I've taught, but we started talking about the topic of pain and racial bias as things have been developing in the media. And I wanted to have you on to talk about this as a physical therapist. So thanks for joining me.
Of course, yeah. You had no idea who I was, but I knew who you were, so I stopped you.
It took a minute. I always kind of, when you're walking on the street in New York City, you're always like in your zone, like rushing to go somewhere. It took me a minute. So Micheal, tell us why you wanted to become a physical therapist and what your practice looks like today.
Yeah, so I guess I have kind of like a unique background growing up. I was homeschooled, and then my mother was a yoga teacher. My dad's a functional medicine physician. So I kind of always had medicine around me to an extent. But I always wanted like more personalized care, and I found PT to be kind of that route. I had PT myself growing up because actually, pretty interesting, they thought I tore my ACL. And the image actually showed that, but it found out later that it was negative. But in general, I had a good experience with PT, and I found that to kind of be more of a route that I wanted to go within medicine.
Interesting. So your dad's a functional medicine physician, so he's an MD.
Yep.
And how long has he been practicing functional medicine?
It's been a long time, ever since I was like very young. So he used to work in a hospital in Newark, New Jersey, and then he left and opened up his own practice. And honestly, yeah, ever since I was very young, I could remember him working. So that his office is actually attached to the house that we grew up in. So that's why I say, I just always remember him working independently.
It's great that he has that perspective, and I'm sure that had an influence on you going into physical therapy school. I think PT school is just now starting to touch on topics of health promotion and nutrition and wellness. You had that probably going into school. Right.
So that idea was always kind of in me, and I found it very interesting that it wasn't talked about enough because that's such a huge part of pain and how we move, and even like emotional, psychological, et cetera. So I always thought it was very interesting we didn't go into more of the biopsychosocial and nutritional aspect.
Yeah. The other thing that's not spoken about enough is pain and racial bias, both just in the bigger community of pain management, and then of course, kind of within our smaller physical therapy community, or our PT community is not so small. Can you tell us how pain is treated differently in the minority or African-American community?
Yeah. So there's actually like a lot of information out there on it. But there's just like one major article that me and you actually have discussed in the past about like pain and racial bias within the African American community. So the title of the article, just so everybody knows, is Racial Bias in Pain Assessment and Treatment Recommendations and False Beliefs About Biological Differences Between Blacks and Whites. And it's an article from a research article from 2016. And it discusses information with lay people and also medical professionals. And basically looks about false beliefs about how Black people feel pain differently than whites that kind of date back to the time of slavery to an extent, and how some ideals have just continued and have not changed. And that just goes on to talk about the idea can result in inadequate treatment. So there's like a list of basically questions that are within the article and discusses biological differences between Blacks and whites, but not all of them are considered accurate. So I'm just going to kind of go through those lists of questions or statements that are directly in the article. So it says, on average, Blacks age more slowly than whites. Black people's nerve endings are less sensitive than white people's nerve endings. Black people's blood coagulates more quickly because of that. Blacks have a lower rate of hemophilia than whites. Whites on average have larger brains than Blacks. Whites are less susceptible to heart disease like hypertension than Blacks. Blacks are less likely to contract spinal cord diseases like multiple sclerosis. Whites have a better sense of hearing compared with Blacks. Blacks' skin has more collagen, i.e. it's thicker than white people's skin. Blacks on average have denser, stronger bones than whites. Blacks have a more sensitive sense of smell than whites, and they can differentiate odors and detect faint smells better than whites. Whites have more efficient respiratory systems than Blacks. Black couples are significantly more fertile than white couples. Whites are less likely to have a stroke than Blacks. Blacks are better at detecting movement than whites. Blacks have stronger immune system than whites and are less likely to contract colds. So those were 15 statements right there. And out of those 15, so they have 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 of those false beliefs. And it'd be very interesting if everyone that's listening to the podcast actually goes through and if they listen to those questions again, actually think about what they think to be true or not true, or like, as it says, possibly untrue, possibly true, et cetera. Because some of them are very kind of outrageous. And the fact that a lot of medical students, so then when I think it was first year medical students thought some of these were true, can lead to a lot of poor treatment.
Yeah. So just to clarify, so 11 out of the 15 that you just read are false. Mm-hmm. Maybe you can tell us the ones that are true from that, or there's some evidence to support it. Okay.
So there's number 5. So it's saying whites are less susceptible to heart disease like hypertension than Blacks. Also number 6, Blacks are less likely to contract spinal cord diseases like multiple sclerosis. It was number 9. Blacks on average have denser, stronger bones than whites. Then number 13, whites are less likely to have a stroke than Blacks. And yep.
And that's it. So with regard to things like less likely to have a stroke and less likely to be susceptible to heart disease, whites versus Blacks, that's really pointing towards people's health disparities, basically, correct?
Mm-hmm. Right, people's health disparities. And that goes again, like deeper. A lot of people of color actually may just not have access to certain resources. So again, that goes to socioeconomic status. And in general, there is a feeling of Blacks towards medicine that's just has not been positive. And that's just because of a long history of things that has occurred over time. So I think even in the list of questions, even those are considered true, they're considered true because I really just think Blacks don't have the access to certain resources that other people do. So.
Right. And then as we look at this list, and of course, everyone can look at that study, or you can just go to the podcast page here. They'll be all listed because everything is transcribed on the Healing Pain podcast. But for instance, looking at this from the perspective of pain management, if a physician, because physicians were asked these questions, mm-hmm. and they were asked, do Blacks have more sensitive or less sensitive nerve endings than whites do? And the majority of people who took this survey said, yes, Blacks have less sensitive nerve endings than whites do. Mm-hmm. So how does that happen? What with regard to the impact on chronic pain, how does that start to shape a practitioner's evaluation and treatment of pain?
Yeah. So when I came to that, like specifically more so in the article, they say that pretty much they're underprescribed pain medication. And also that could lead to maybe not getting access to physical therapy in general, because they may not think that since they tolerate pain differently, as we say, because they're sensitive nerve endings, they may just kind of dismiss their pain and not think about pain medication, alternative services, et cetera. So that just leads to increased health disparity.
Mm-hmm. And there's other ones in here that I thought were just somewhat odd. For instance, Blacks are better at detecting movement than whites, which just sounds completely bizarre.
It does sound bizarre, but there's just a long history of stuff associated with that. So that's why often people will say Blacks are more likely to get into athletics or get into sports of some sort, because they say that they move better, they're quicker, they're better, better at detecting movements than whites. And there's stuff that we just we don't even think about that we're saying, and it just continues, and it's kind of like a spiral effect. So there's a lot of things in here that kind of like you sit back and like a little outrageous, but you actually hear it every day. You see it on TV, you see it in the media, and it's pretty scary, because that kind of like that's what's making our implicit bias to an extent.
Right. So these obviously started culturally, and then somehow have been carried over and reinforced within healthcare.
Mm-hmm.
Yeah. Right. And then that last one on that list there, I think it's really important to just, mention this one during this time of COVID, that Blacks have stronger immune systems than white people do. And I just think about that right now, and we're looking at the fallout, especially in the United States from COVID, and seeing how it's impacting people of color, and knowing that there are physicians out there that may believe that, well, maybe they'll have a better outcome because they have a better immune system or a stronger immune system.
Yeah. And it's kind of like, it's kind of crazy that statement is there, because you see the exact opposite thing on the news or other things saying so forth, like, well, Blacks don't have access to certain resources, or they're more likely to have increased health disparities. Well, if they're more likely to have increased health disparities, how is it possible to have a stronger immune system? Like, it doesn't even make sense as to why that's even on there.
Mm-hmm. And then let's, just from your perspective as a physical therapist, with regard to what you've seen in your career with regard to minorities and African Americans accessing physical therapy versus how whites or other populations access physical therapy, what are your perspectives on that?
So the interesting thing is, I've worked in a lot of different settings and a lot of different outpatient settings, and I will say I still have not seen a lot of people of color. And I don't know if that's been the same with you or not, like depending like which settings you've worked with and so forth. I've worked in network, I've worked out of network, I've worked boutique, I worked somewhat personal training settings, as they would say. And very, very rarely would I see people of color. And if it was people of color, it was most likely 65 and older. But again, there was still not much 65 and older when it comes to that extent. So that's a hard topic to talk about. Every time I think about it, I've just asked friends, and basically I've asked like family members and asked why they think that is. And the idea is that there's the idea that most people of color do not feel safe within the medical profession, so they're not seeking out medical professionals. There's also there's not that many people of color within the medical profession. So if there's not that many people of color, a lot of people are going to more so emergency services first versus alternative therapies, alternative services first. And also then it comes to costs. So there's a lot of like ideas as to why it may occur, but I think the major reason is that there's been a long history of people of color not feeling safe within the medical profession. So that's not the first route they're always going to go.
Mm-hmm. And when you say safe, of course, we're talking about people understanding them first. So if other licensed health professionals think that their nerve endings are less sensitive, obviously they don't feel safe going into a pain management arena. But then there's also the fact that there's no one that looks like them. There's no practitioners that look like them within the healthcare system, or at least especially within physical therapy, which I know we're going to talk about in a little while.
Right. So I think that's always like a twofold topic. So one, the people not looking like them, but also like the major socioeconomic status. So I was saying like one article that I've read, and also as I've asked people, there's people of color, even like within some articles, and they're saying it's not the fact that they're Black, it's the fact that they also don't have the resources to access certain areas. So that's like a major portion I saw, that it wasn't always just black and white. It was more so, hey, if I was honestly a person of color, but I had a lot of money, then I could probably access whatever I needed. But they even though they did always say they may have to push a little bit more to kind of access those resources, but if they're able to access those resources having higher status in society, then they'll be okay. And then there's the other side saying that inadequate minority representation within healthcare professionals causes a reduced utilization of preventative care and like increased utilization of emergency services. So that comes to also the education portion, is that since more people of color are within medicine or PT in general, then that like ideal or education of what medicine is, what physical therapy is, isn't kind of like being spread around.
Mm-hmm. And then just, both you and I practice in New York City. I mean, when I think about access, I've seen patient deductibles that are $10,000 and copays that are $100.
Yeah.
So it, of course, deters everyone, but anyone who's in a lower socioeconomic realm, especially in New York City, it deters them completely from accessing physical therapy or any other kind of pain service.
Yeah. Like most recently, I actually saw someone's deductible that was $22,000, which was actually insane. And I've honestly never seen that before. So I was like, I understand with some people, like I always say physical therapy is very much so a boutique or luxury service. Like no matter, I was speaking to to a client one day, and she's like, and she's from abroad, she's from New Zealand, and she's like, no, physical therapy is something like, it's not boutique, it's what everybody needs. But I was like, in our society, for some reason, it's definitely not a service that everybody gets or everybody's directed towards. So it is a luxury service, and it can be costly 3 times a week for a period of time or 2 times a week for a period of time. And that's not something, honestly, in general, I would say people of color don't look for medicine, but then they're going to start to look for medicine that's costly. And also they don't know the effects of it to an extent. So then it just causes it's just kind of a cascade effect on the way.
Yeah. There's an affordability hurdle there that exists for many people.
Yeah.
Let's talk about physical therapy for a minute. And it's, I was born and raised in New York City. So some of the information I read sometimes is, just is a little shocking to me, because I come from a family that's multicultural. I went to a school in Brooklyn that was completely multicultural. But if you start to look at diversity specifically within the physical therapy profession, what do we see?
Yeah, so according to the APTA, and this is from 2016, showed that the workforce data showed that our profession is 90% white female. And out of another portion of this is approximately out of 34,000 students enrolled in an accredited PT program throughout the U.S. during the 2018 to 2019 academic year, 74.6% self-reported as white, 3.4% as African-American/Black, and also 6.5% as Hispanic. And as we know, our profession should represent kind of like the world we live in to an extent, or America. So those numbers don't represent America in general. So if our profession isn't representing what we're treating or we're around, then there's going to be I think a skewed, basically skewed treatment.
And I think, the fact that it's 90% white female is not a shock to any of us. Because if you go to any APTA conference, any PT conference, it looks just like that.
Right, but that's also how the profession started. So I think that's always going to be kind of it's always going to be majority female, because that's kind of how the profession started. What
do you think we can do to encourage schools and directors to recruit more people of color into the profession?
I don't know if it's encouraging or recruiting more people. I think it has to start at a level below kind of like college. Like it has to start within high school, it has to start within middle school. Because there's I think a bigger picture as to why the numbers are that way. So there's not enough education as to what we do in the profession. To be very honest, me going into PT school, I didn't, after after I left, I actually still didn't know what we did. I had to like start working and understanding it a bit more, and also the vast areas we could go into and how I want to treat. And I think the major thing, unfortunately, is the cost to earning potential. The cost of PT education is so high, but the earning potential, depending on the direction you go, can be low. So it's not something that most people, and especially most people of color, are going to jump into going to if if you're spending a massive amount to go and your cost back is not going to be enough. And so typically I would just say that people that are in lower socioeconomic areas are probably going to look for careers that are more lucrative. So I think that's a big reason as to why the people of color portion within the statistics we mentioned are not like jumping to go into the PT realm. One is education on what it is, but then the cost to earning potential is pretty vast.
And then in PT school,
Yeah,
I graduated quite a long time before you,
okay.
probably, Micheal. But I'm just wondering, when you were in school, did they go over topics like racial bias in healthcare or racial bias in pain medicine? Obviously, since primarily we treat pain as physical therapists.
We did, but it was very very minimal. And I will say personally, wasn't like the school that I went to, but within the social, I was also the only student of color in my class, which is probably in most PT schools is like one or two students of color. And there is, when you hear things, there is this ideal of people of color having or feeling pain differently. So you do hear that within the school realm, and it just kind of continues and goes. And the crazy part is being in general, a person of color, et cetera, you hear these things and you kind of get used to hearing it. And you start to maybe think it yourself without really like knowing or researching on it. So I think that's why the article we read earlier would be interesting if they looked into, I know they looked at mainly white people when it comes to pain and racial bias, but it'll be interesting to look at non-whites to see what their views are, because like you talk about a little bit in school, but it's not talked about enough to actually like erase or like address people's implicit bias.
So when you reflect back on your DPT program experience, you can remember some of those themes showing up in the program.
Yes. So I was, let's say when I was in school, there were ideals, especially like maybe some classes or classmates, et cetera, that may have, like there was this idea of that, honestly, I remember there was one ideal that I heard that Black babies' nervous systems develop differently than white babies. And this was said in like, kind of like something that I'm not sure why it was discussed or said. And it gives the idea that there needs to be a different like measurement system basically for Black babies, because their nervous systems develop differently. So, and that goes back to what we were talking about before, having that idea of like the nervous system for people of color is different than white people. So I'm not sure for you in school if you guys talked about any of this kind of stuff or like had these discussions, but we had some of these discussions, but it was very minimal. So
I'm just thinking from your perspective as a Black PT student, it must put you in a very interesting or precarious position when, I don't know if this is a fellow classmate or a professor who's saying this, and then do you feel like you have to correct them or at least make them aware that what they're saying may have some prejudice or influence on, that's coming out of it?
So this is also a discussion that I've had with, I guess, other classmates of color in the past, even from like undergrad, et cetera. And I will say, and I feel like discussions like these need to happen more often or in generals, and so people feel safe to talk about it without feeling like judged to any extent. This is on both sides. So I will say I didn't feel comfortable bringing it up or saying like, I think that's incorrect when statements or something may be made, because I do think in general, in our society and in general within medicine or within schooling, that people of color have to make themselves feel comfortable within white spaces. But I will say that white spaces do not have to be made feel comfortable with people of color. So that makes it like a very iffy feeling when you're within school and that stuff is occurring, because you may not know how to address that situation, since you are, like you said, the minority, and you have a certain view of it, but nobody else has that view. So yeah.
How would you like to see pain improved in our profession with regard to racial bias? How would you like to see just the profession of physical therapy address racial bias more deeply than it has?
I feel like now this year has forced everybody to look at their implicit bias, no matter if like they want to or not. So I think it's not like, I don't know if it's the APTA addressing it more. I think it does need to be addressed. They need to address it. But I think people in general need to be more comfortable talking about these situations and talking about their implicit bias. So I think open conversations in general just need to happen more. Without open conversation, then you can teach somebody anything. But if somebody is like not open to talking about it, or even open to addressing their implicit bias or even their ideals of race in society, then it's really not going to go anywhere. So I really just think open conversations need to happen more often. But,
yeah. Many professional associations have minority special interest groups.
right.
Do we have that in the American Physical Therapy Association?
I'm not gonna lie to you, I have no idea. So do you know that, or is it?
I don't. It's just, as we're talking about, I just thought I've never heard of it. I've never seen it advertised.
Right.
I'm hoping we have one, but I'm just, if it hasn't come across your plate and it hasn't come across my plate, I'm wondering if either it's something that's recent or if it's something that just is not promoted widely enough throughout the profession.
Right. Because I would think it would be promoted within, like, when you're in schooling, because like I think most schools you have to join the APTA as a student. So I think as a student, and also if you're like ticking the box off of being African American of some sort, then I would think they would mail something out or do something to that extent. But I didn't hear or know anything about that.
Yeah. What do you think, like an outpatient, let's say an outpatient physical therapy practice, or maybe a PT group within the hospital, what can they do with regard to tests and measures to check things like bias within their own inner circle and community?
Yeah, so there's something called like an implicit association test, and it's through Harvard, and they have different ones. They have one on race, they have one on sexuality, there's one on like skin tone, and basically it's just like you go through a series of questions and like you tick off, similar to like ones we talked about before, if you think maybe true, possibly untrue, or et cetera. And at the end, it shows areas that may be true, not true, and it kind of causes you, or it forces you to like check your implicit bias to an extent. Mm-hmm. That's like the only one I know of that's as far as that test out there that will check for implicit bias. I think bigger within like universities and hospitals and schools is just collecting data when it comes to certain stuff. So I mean, collecting data on, like, if it's allowed, collecting data on your patients. So seeing like how many patients are of color, how many patients are white, how many patients, et cetera. How long are their treatment sessions? How long are they within the system? 10 visits, 15 visits? Because I think that'll be interesting to see if like patients of color are treated for shorter periods of time. And also maybe if their plan of care has also been shorter, et cetera. So I think there just needs to be more data collected in general.
Right, and private practice owners can do that. Larger hospital, of course, mm-hmm. and medical centers, universities can do that as well. Mm-hmm. Micheal, it's been a pleasure speaking with you today about pain and racial bias. Can you tell everyone listening how they can learn more about you and reach out to you?
Yep. So I'm based in New Jersey and New York. And you can email me. It's at micheal@racetorecover.com. And I'm not really I'm not really into social media that much or any other aspects. So I don't really have any of those, but you can always just email me. That'll be the easiest way to get me.
Great. So I want to thank Micheal for joining me this week on the Healing Pain Podcast. You can, of course, reach out to him if you live in New York or New Jersey. His email is micheal@racetorecover.com. Make sure you share this episode out with your friends and family on Facebook, Twitter, LinkedIn, or wherever people are talking about pain and racial bias. I'm Dr. Joe Tatta, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. reinventing.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.